Good afternoon. Today is May 16th, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is that the Food and Drug Administration announced today that it has granted emergency clearance for another coronavirus test that allows users to check themselves for the virus at home. And this would be the third approval for an in-home test, following one sold by LabCorp and one sold by the Rutgers University Laboratory. The newly approved kits are made by the company Everlywell and available by prescription only. They would allow individuals to take a nozzle sample and send it to a laboratory for diagnostic testing. So the FDA and I think that hope that the availability of another kit would increase access to testing nationally, as well as reduce the risks facing healthcare workers who mainly administer tests in person. And I think these in-home tests, while they have some limitations, including longer days to receive the result, I feel like this would be extremely useful and helpful, and since the testing has ramped up, I hope that more tests will be available, not just for the ones who are prescribed, but also for just the general public, even though they haven't been showing symptoms. The second thing that I like to talk about is quite interesting. So in Ukraine, there is an extremely large surrogacy rate, where basically surrogate mothers will deliver a child for parents who are unable to for some reason, or for just single parents wanting a child. So as a result, currently, it may lead the world in the number of surrogate births for foreign biological parents. And personally, I think this just started because of poverty, because, well, the cheapest surrogacy in Europe is in Ukraine, which is literally the poorest country in Europe. To curb the spread of the coronavirus, Ukraine has put a travel ban on foreigners, and with exceptions granted only if an embassy intervenes to arrange travel. And yet the problem right now is that 100 babies are stranded in Ukraine after surrogate birth because their foreign parents can't travel here and receive the baby. So I think this is just going to be an extremely large problem. And one official says that as many as 1,000 babies will be born before restrictions are lifted for the travel ban. To solve this problem, I don't know whether it's that Ukraine should stop this surrogacy business, or I think that currently at this rate, maybe the embassy could perhaps grant exceptions. After all, foreign parents, all they have to do is just come to receive the baby. But after all, childcare is going to be extremely expensive. And right now, I don't think that there's going to be many caregivers who is able to take care of so many babies with social distancing and such. The third thing that I'd like to talk about is that many frontline workers, such as medical workers, emergency workers, and doctors, have been extremely pressured because after all, being a physician is an extremely tiring and pressuring job, and many people they have just been afraid to seek help of their mental health. And now with the Covid-19, many mental experts are thinking that it is only going to get worse. A March study looked at the psychological impact of the epidemic on healthcare workers in 34 Chinese hospitals and reported that many had elevated rates of anxiety, depression, and insomnia. So I think especially as the medical workers are facing death almost every day. This workers do have a limited capacity. They have a larger burden, and they also have a fear of contaminating family members. So, therefore, they could have just having increased levels of PTSD, anxiety, stress should be very common. And I think that personally, I think that to address this problem, therapists and mental health experts who specialize in treating trauma should offer perhaps free sessions to medical workers and emergency responders, including what is happening in New York City. And this can be done to just help these medical workers, but also that medical workers, they should also seek help, because many feel like if they seek help, it's like showing weakness, and honestly, that's really dangerous. So I think medical workers should seek help, and it's just protecting yourself from destructive symptoms in the long term of like that comes with PTSD, these traumatic events. That's it. Thank you for listening, and I hope you have a good day. Thank you.